Thank you for your interest in Grand Health and our services. In this video, I will actually be going over our consent to treat form that you have access to on our website at www.grand.health. So let's go ahead and just get started here. Some of the key terms that I want you to be aware of as we go through our consent to treat form. One of them is the NADA, and that is just an acronym that stands for the National Acupuncture Detoxification Association. This is the organization that actually developed the 5-point protocol that you would be receiving from us as a treatment. And if you, of course, want any more information about the organization, their website is Acudetox.com. Another term that you're going to see on the consent to treat form is the term Acudetox itself, and it's actually a conjunction of two words, acu for acupuncture or auricular acupuncture, and then detox, of course, referring to detoxification. So in Acudetox, what we're basically talking about is ear acupuncture that detoxifies the body. Another term that you're going to see is an Acudetox Specialist. And an Acudetox Specialist is an individual who's been trained in the NADA protocol and has received proper credentialing through the National Acupuncture Detoxification Association. Now, when we look at the treatment description, and try to figure out what we're doing or what we're going to do, the NADA protocol itself, Acudetox, is performed by inserting up to 5 thin sterilized needles into the surface of each ear on predefined locations as approved by the state of Colorado. And those acupoints are actually sympathetic, shin min, kidney, liver, and lung. And treatments can also be administered by placing beads or seeds onto the surface of each ear if there is a contraindication to using acupuncture needles. And sometimes that, contraindication can just basically be a preference for using beads or seeds, but some individuals might also have a fear of needles and so on. And of course, there might be situations where we would not, use an acupuncture needle. Let's say if the skin is broken on the acupuncture point, or if there's a wound of some sort there, or if there's scarring, or if there happens to be a wart there, then we're generally not going to, administer an acupuncture needle into that point itself, okay? Now, the acupuncture treatment is provided for 30 to 45 minutes under normal circumstances, while the beads or seed placement can stay on the ear for up to 5 days. And so the beads and seeds have a little stickum Band-Aid type of surface on them. And so, you can just remove those at your own personal leisure. Of course, due to community health concerns, acupuncture treatment times may be decreased to 10 to 15 minutes based upon the number of individuals present and, of course, any local and state public health guidelines. And then treatments are conducted in a group setting whenever possible, okay? And treatments may be provided by an Acudetox Specialist, an appropriate licensed acupuncture professional, or a supervised trainee in accordance with Colorado revised statutes. Now, one of the beauties of the Acudetox, the NADA protocol itself, there's also a play on that word nada with the Spanish term nada, meaning nothing. And the Acudetox treatment is actually a non-talk therapy. So an individual doesn't really need to reveal any information about themselves. There's not really any interaction, and you're not being asked to speak your mind or anything like that, or to share any feelings or anything like that. It's not that kind of treatment. So it is a non-talk therapy, and that's why we do it mostly in a group atmosphere. And under normal circumstances, we could have anywhere from 10 to 20 people in a group. It just depends on the location size and of course any stipulations that might be going on with public health. Now, some of the possible benefits of treatment with the NADA protocol is that it has been shown to be helpful in recovery support and relapse prevention, and also in relieving acute symptoms of withdrawal from a variety of substances and addictive behaviors. The NADA protocol has also been helpful in reducing anxiety, stress, insomnia, cravings, depression, PTSD, trauma, in addition to being used in smoking cessation, co-occurring disorders, and for general health and wellness. And then recipients of the NADA protocol often feel immediate relaxation and a decrease in tension and anxiety. Additional treatments of the NADA protocol may reduce withdrawal symptoms such as profuse sweating, headaches, body aches, stomach pain, drug dreams, cravings, etc. And recipients may also develop a greater sense of understanding and connection with themselves. Now, each individual may respond differently to the treatment, but these are some common experiences that take place. Okay? And something to keep in mind here, it's important to understand that an individual does not need to have any health concerns to benefit from this treatment, nor is it required to have any ailment or any diagnosis to receive this treatment. Okay? So if you're just wanting to check it out, see what it's all about, that's perfectly fine. Now, as far as your voluntary consent, what you are consenting to are the following, okay? And as I'm reading this here, this would actually be as though you are reading this directly. So you're stating that I hereby acknowledge that my participation in the NADA protocol is purely voluntary, and I consent to be treated with Acudetox. I understand that I may be treated with acupuncture needles that penetrate the skin 1/8 of an inch, and or with the application of beads or seeds, and that is acupressure that does not penetrate the skin upon each ear. Okay? I have not been guaranteed any specific outcomes concerning the uses and effects of Acudetox, and I understand that I am free to discontinue Acudetox treatment at any time. Okay? And then there are some possible side effects or reactions to the healing itself. All right? So you are stating that I understand that Acudetox may result in certain side effects, including local bruising, slight bleeding, fainting, emotional response, temporary pain and discomfort, and temporary aggravation of symptoms existing prior to treatment. Now, I personally haven't witnessed those per se with any of the treatments that I've done or been around, with the exception to slight bleeding, and that usually occurs on maybe one point when you're removing a needle from the ear, but it's easy to address. At one of the trainings that I was at, one of my colleagues became emotional, but that was because we were doing so many treatments in there over a few days and everything. So an individual can have an emotional response to where they become, to the point where they're weeping and everything, and that's okay, but that's common, okay, and that's okay. Now, also, there may be conventional medical treatment that is also indicated, either in response to an emergency or as deemed necessary at the discretion of an appropriate healthcare professional or practitioner. Okay. Now, as mentioned, I haven't experienced those, but in some of the some of the trainings that I've been in, and having the physicians talking about it, They've explained some situations where, individuals had fainted or whatnot, or they had needle shock or whatnot. And so, there was some emergency scenarios just to ensure that the patient was safe and everything like that. Okay. So it's just important to be aware of those things, and every person can respond differently. Of course, if you're going to one of our sessions, I can just administer one needle at a time in each ear and just check on you to see how that feels to you, and watch you and make sure you're doing okay. And then I can insert another needle a few minutes after that and everything. So, we definitely want to make sure that everybody's okay and not experiencing any side effects from this. And then I understand that if there is a worsening of an ailment or a condition, or if a new ailment or condition arises, I should consult a licensed physician or appropriate primary care practitioner. I also understand that if I am currently under a physician's care, I should continue if my physician and I deem it necessary. And then this program, the NADA protocol, Acudetox, does not recommend altering medications or other therapies without first consulting my personal physician or healthcare provider. And then just going over some infectious disease and our clean needle techniques that we use here. I understand that there are infectious diseases which have the potential to be carried through the air, through physical contact, and through body fluids. I understand that an ADS, an Acudetox Specialist, a licensed acupuncture professionals, and supervised trainees all follow universally prescribed precautions to guard against the spread of infection. In the case of blood-borne infections, such as hepatitis or HIV, I understand that the Acudetox providers of this treatment follow strict precautions and use only sterilized, prepackaged, disposable needles. The acupuncture needles that are used for this treatment are single-use and applied accordingly to national-based professional standards. And with the needles, you'll be an active participant with that, where I might have you hold the packet itself, where you can look at it and you can see that it's sealed and everything, okay? And then I further understand that I am responsible for cleaning my ears with sterile alcohol pads or another skin cleansing agent prior to and after Acudetox treatment, and that the treatment location will provide these supplies. And yes, I will have little individual alcohol pads on site, in addition to another cleansing agent like witch hazel or whatnot with cotton balls. If your skin is irritated by the alcohol swab pads and everything, so I will provide that stuff on site, so you don't have to worry about that. And then it's just a simple cleaning of your ears, and that stuff can be easily thrown away. Okay. So that is the information that we have on our consent to treat form. It covers all of the legal liabilities that we need to go over. And of course, I did verify that a verbal consent is acceptable both in consent laws and in HIPAA laws as well. And we are clear on that. Of course, you can click on the link that goes to the HIPAA information on our consent to treat page itself if you want to, view more information about that. But before I provide any treatment to you, I need you to acknowledge to me that you give consent to treat with the NADA protocol. And of course, this will be done verbally on site with the individual administering the treatment, which will generally be me unless I have some other colleagues come up and assist on some treatment days and everything, okay? And at that time, I'll provide some additional instructions, and then I'll also have, some Q&A before we get started as well. I look forward to seeing you at one of our sessions here in the near future. Thanks for your time.